to psychotherapist Dr. Robi Ludwig on how parents can keep calm and care for their kids at the same time. Doctor, welcome to the program.
Thank you.
Are you of the mind that says all children of all ages must be talked to about these kind of issues like Ebola? Because I would say you got a 5 or 6 year old child, you don't go rattling on about Ebola to somebody as young as that.
No, it's a really good point. So for somebody who's younger, you want to find out what they know about it. They may not know a lot about what's going on with Ebola, and you want to monitor also what they're seeing on television.
But you wouldn't want to question. You wouldn't want to question a 6-year-old. What do you know about Ebola? You wouldn't say that.
But I have kids who are tweens and teens, and they brought it up to me. And so as a parent, you want to be cognizant if your child is bringing it up, and they brought it up in a humorous way. So I realized they were trying to deal with their anxiety about it, but really kids respond to how their parents are reacting to something. So if a parent is calm and has good information, a child will feel more protected and comfortable.
What do you actually say? What are the words used? What's the tone used? Let's, for example, a 12, 13, 14-year-old youngster who the subject comes up. What do you say?
It's not airborne. It's this is very hard to get. We're taking a lot of precautions. We have the best people in the world that are looking at how to treat Ebola. As parents, we will keep you safe. Wash your hands. This is like the silver lining. Parents can say the best way to keep yourself safe in general from any type of cold or illness. Wash your hands. Get good sleep. Make sure that you are eating properly so that your immune system is strong.
You wouldn't say that to a 12-year-old.
I would,
Get enough sleep.
Have.
Make sure you're eating the right
please,
things.
You should see in my house.
But
get
really,
enough sleep. Go to sleep. Please go to sleep.
Would you actually say that to a child in a conversation about get enough sleep?
I would sense their anxiety level. And so if they were worried, what you try to do is you give the child a sense of what they have control over. They have control over washing their hands. They have control over understanding it's not airborne and that it's very hard to get.
How about a 5, 6, 7-year-old?
Well, you then say, listen, mommy and daddy are going to make sure that you're protected and safe, just like we always do. And so you just communicate to them that parents are there to keep kids safe and that you will honor that agreement. I mean, not in those words, but basically that you're there to keep them safe, and you're going to continue to do that.
If it comes up, you would start saying something, but you wouldn't introduce that subject in conversation unless they'd asked about it.
Right. I might
young
find
kids.
With young kids, I would find out what they know about it, because you don't want to induce fear. Your job as a parent is to make them feel comfortable, but keep the communication lines open so that your kids know that they can talk to you if they're nervous or worried about something, and this might be one of the many topics they get anxious about.
Dr. Robi Ludwig, always good advice. Thank you very much indeed.
Great to be here.
Okay.